Beth Daniels, and what I want to talk about is the train of 4. What we usually they use this in anesthesia in the OR, but what we use it for in critical care is for paralytics. When we give them paralytics and we give them sedation and analgesia, we want to make sure that we're not giving them too much. So I've enclosed a handout for you, and that you can follow along with me with. And the other thing is that I've also enclosed a charting sheet, which I didn't bring with me because I gave you all my last one. And you do this every 4 hours unless you make a med change. If you make a med change, then you do this every 30 minutes. And what I want to discuss is lead placement, nursing care, and the reaction that it does with each lead placement. This is a train of 4. And this is, you turn it on the side. And you'll see the little green to let you know the battery's working. When you, it's on standby now, and then you'll push switch when you want it to go. The black is negative and the red is positive, and the black is what stimulates the twitch. If you don't have any twitches, that means you're getting too much medicine. If you have 3 to 2, the patient can move some. If you have 1, you need some more medicine. So, because you don't want your patient so paralyzed that they're just laying. I mean, you do, but you want them, what do I want to say? You just don't want them to where they're not going to do anything. And always, always give sedation and analgesia, because you don't want the patient being wide awake, laying there, not being able to move. So, the first, I'll show you where these are the patches. You just use regular EKG patches. Now, the only place that I have used them is on the face. And you place one right here, and you place one right here. And you place the black lead right here. And when you turn it on for the twitches, because it will deliver 4 twitches, your eye will blink, twitch. If you put it, the other place is the ulnar nerve. And what you do is you place one right here and one right here. The black one goes here and the red one goes here. And what you'll have is your the thumb abduction. It'll go like this. Now, I've never used, the other one is the posterior tibial. You find the pulse and you place the electrode on the bottom next to the foot, and then one just above it. And what it does is make the big toe curl. So, which I've never used. I've worked, we've used them here at Greenbrier Valley, and I've used them at Roanoke. And Roanoke, it was open heart, and we wanted to keep them quiet. Here, we used it, we had to, the man was obese, and he couldn't breathe, so we had to trach him, and they just wanted him to keep quiet so he could oxygenate better. So we used it. Now, nursing care for the patient that's paralyzed, always, always DVT prophylaxis. Because they're just laying there, even though you're turning them slightly, they're not getting to move around. So either it's SCDs, heparin, Lovenox, whichever. Sedation and analgesia. You know, make sure you have your fentanyl, your Versed, whatever, to keep them sedated along with paralyzed. The big thing for me is eye care. You know, they don't have a blink response when they're paralyzed. They're just laying there. So what you need to do is lubricate their eyes and maybe lay 4x4s over the lubrication, wet 4x4s. so that, you know, you'll keep their eyes moist, because they can get corneal abrasions, just about anything. And the last thing is your mouth care. Always do mouth care every hour or more to keep their mouth moist. That's all I have right now. If you have any questions, please let me know. Thank you.